One of the most important things when we see a patient is to define whether or not they're cryptogenic. In a patient who has known atherosclerotic risk factors, we'll often diagnose them as a small vessel disease. That's not a cryptogenic stroke, and they wouldn't be a candidate for PFO closure whether or not they have a PFO. I recently had a patient who was a 70-year-old retired physician come in, and he'd been found to have a new lacunar stroke. During his workup, a PFO was found. I reviewed his risk factors, and he has hypertension, diabetes, and it turns out he'd had a previous clinical stroke, and the most recent stroke was a lacunar infarct. One of the best tools I've found for that is the ROPE score. And this is a 10-point score that takes into account typical atherosclerotic risk factors. By putting those factors together, you can see the PFO attributable fraction, and if it's more than 50%, I consider that a patient that we should consider for closure. And based on his ROPE score, he was in the 0 to 3 range, which means the likelihood that the PFO would contribute and the likelihood of benefit from PFO closure was so low it was not recommended.